Erectile dysfunction is defined by the inability to achieve an erection for sexual intimacy and penetration, and that result in significant psychosocial distress to the patient. So sometimes, if we look at the definition, we also need to acknowledge the fact that some patients are able to achieve erection, but not erection sufficient for sexual penetration. And the important thing is that it underlines that it causes psychological distress to the patient. So I think when we talk about erectile dysfunction, we need to acknowledge that it is not just about a penile erection, but also about the mental well-being of the patient. How common is ED affecting the general public? There are many epidemiological studies that show that ED affect many percentage of population. In Australia, for example, we know that up to about 40% of Australian male can have erectile dysfunction. And this could range from patients as early as in their teens, 15 or 16, all the way to the 80s. And we all know that as you get older, you're more likely to have erectile dysfunction. And also we know that if you have medical comorbidities like hypertension, cholesterol, diabetes, you're also more likely to have severe erectile dysfunction. So we have patients who are young patients who have basically never experienced sexual intimacy, and they basically base everything on pornography and also what they hear from their peers. So this group of patients has majority a psychogenic component of the erectile function. So this patient may have unrealistic expectation and may not sure what exactly the erection should do and should look like. And then we have a group of patients who have medical comorbidities. For example, they have hypertension, they have dyslipidemia, they have diabetes, they got cardiovascular disease. And then there are a group of patients who have treatment as a result of other conditions. For example, prostate cancer, where Australians have very high incidence of prostate cancer. So this group of patients develop erectile dysfunction following robotic surgery or following radiation for the prostate cancer. And also we have a group of patients who previously have normal sexual function, but after their partner passed away, have re-engaged in sexual intimacy again. And that can also create anxiety. And these are the group of patients that we see in the later part of life. We don't know that the certain things like smoking, consumption of certain drugs like marijuana, for example, can certainly impact on that. We know that stress, the lack of sleep, can certainly impact on erectile dysfunction. And I guess more importantly these days, pornography. So pornography also can impact on erectile function because they have very unrealistic expectation of what the size of the penis is about. Anything that can make you feel like you're less of a man can affect your confidence, can affect your masculinity, and can certainly affect how your mind works. So I think that certainly can contribute to worsening of your erectile function. Well, what are the stigma associated with erectile dysfunction? This is a broad topic because we do know that erectile dysfunction can cause psychosocial distress. Psychologically, patients notice that they get depression, they get anxiety. Some patients can actually have a different outcome. For example, they become irritable and they can become quite aggressive because they don't feel like they are able to achieve erection. We also know that from a psychological point of view, when you have erectile dysfunction, many patients have difficulty with concentration and productivity. And furthermore, it can also lead to withdrawal. So many patients find that they are unable to engage in something sexually intimate, and this could lead to relationship breakdown. Well, spontan, the word sounds interesting, isn't it? Because it means spontaneous. So spontan has two real benefits that we can see immediately. Number one is spontaneous. So we know that sexual intimacy is a spontaneous activity most of the time. So a patient doesn't really need to sort of arrange a time to take a drug before they engage in sexual intimacy. So spontan fulfills the spontaneity from that point of view. And the second benefit is that being a nasal delivery technology, you get the benefit of the nasal system. So it means that the drug works faster. The drug certainly works on a smaller concentration compared to other drugs. So potentially you could have lower side effect profile. In terms of the efficacy for SPONTAN, what we have known from a published phase 1/2a study is that SPONTANs certainly are efficacious, and importantly, from a pharmacodynamic point of view, it shows similar efficacy to a drug vardenafil, which is a approved drug for erectile dysfunction. And when we look at the drug pharmacokinetic, we see that SPONTAN work faster and achieve similar efficacy at a smaller dosage. So this is something very exciting.